Yes. Okay. Good evening, everyone. I'm Harry Thirlby, stud manager at West Kington Stud, and I'm delighted to welcome you to the third instalment in our Breeding for Excellence series of webinars, brought to you in partnership by West Kington Stud and B&W Equine Vets. Tonight's event is aimed at mare owners and breeders, and we'll be looking at the different methods and technologies available in breeding your mare. To help make the right decision, we have a panel of knowledgeable and experienced speakers to share their expertise with you. So, tonight's speakers are... So before we get started, I'll give you a quick rundown of what to expect from tonight's webinar. At West Kington Stud, we work very closely with B&W Equine Vets on a daily basis. We're very privileged to be joined tonight by three vets who are members of their excellent reproduction team. First, you'll hear from Chris Shepherd, who's been involved with West Kington since the stud was founded back in the 1990s. We'll then hear from Kelly Harrison-Tate, Clinical Director of Stud and Reproduction at B&W. And our final speaker will be Anna Mitchell, recognised specialist in equine reproduction, and our main day-to-day vets for all of the mare and stallion work that we do here at WKS. Following the presentations, there'll be a Q&A session where you can ask our panel any questions you may have. Please use the question and answer box throughout the talks, and we'll answer as many of these questions as we can at the end of the evening. And finally, I'd like to remind you that this webinar is being recorded, so a link will be made available on our website and on our social media after the event. So please do share that around and let people know. Before you hear from our vets, I'll be covering considerations with preparing to breed from your mare. So we'd start with pre-breeding tests. The tests that your mare needs will depend very much on where she might be going, what the stud's requirements are that are taking her, and indeed whether she's being AI'd or naturally covered. This will all make a difference. The most sort of bog standard test that we would expect a mare to have at the beginning of the breeding season or before any work commences would be a clitoral swab for contagious equine metritis, more commonly known as CEM, which is a highly contagious venereal disease, and also a blood sample for equine viral arteritis, or EVA, again, highly contagious and a big cause of abortion in mares, so not something anyone breeding horses will want on their premises. These tests should be required for acceptance to any reputable stud. They may also be required by stallion owners, even if they are only posting semen out to you for your mare for AI, as they will want to see that your mare is free of disease. Mare owners should always check that the stallion they're using has the equivalent health tests, at least carried out at the beginning of the current breeding season, as he obviously can transmit these diseases through his semen. Further tests may well be required for other transmissible diseases if your mare's going away to stud, so always check with the stud first. And there could be further investigative scans, breeding soundness exams, uterine biopsies, etc., could all be done if there's reason to suspect that your mare might be difficult, but it is often easier for these things to be performed on a stud. So again, talking to your vet in the first place is the best way to go about it. And just over at the side there, we have an example of a CEM certificate. That is, in fact, from a stallion, so not terribly relevant. Just to sort of show what we're looking for and that they must always be negative or not isolated. So it's that. The significance of age in mares is something that so many people you speak to will have hugely differing opinions on. We've all heard the tales of the person whose yearling filly got in foal, and we've all heard the opposite end of the spectrum where the 29-year-old mare got covered by the colt she was nannying. Obviously, these things do happen, can happen, and the potential breeding window of a mare is extremely long throughout her life. However, the window in which she should be considered a prime breeding prospect is significantly narrower. So slightly generalizing here, but we would say an ideal age to start breeding a mare would be between 4 and 10. She should at this point be mature, physically able. Many people will put them in foal at 3 and some people at 2, but between 4 and 10, you would hope a mare is sort of at her peak health and fertility. So the majority of mares, because we cannot generalize, will be at their most fertile in that time period. Mares that begin breeding at a fairly young age often do carry on very successfully well into their late teens. And again, it really does come down to the individual mare. Again, to generalize, we would say that older teenage maiden mares would have the highest incidence of issues. They tend to have things such as tight and fibrotic cervixes, which cause big fluid retention post-AI and covering, which doesn't help with conception rates. But most importantly, what we always have to say is each mare is an individual, and yeah, they can all surprise us. Condition of the mare, of course, quite simply, at the time of arriving and conception, you would want your mare to be in good condition. That is, you don't want her too fat, you don't want her too thin, as close to the middle of whatever body condition score system you would use is where you want her to be. And whilst, of course, a level of fitness could be helpful with your mare's overall health, being fit enough to run in the Grand National is probably detrimental. So would sometimes recommend a period of letting down for very serious competition horses. But yeah, ultimately you are looking for a mare that is in good condition, healthy. Nutrition is, of course, very important all the time. It becomes hugely pressing in late pregnancy, but having the mare on a good, even keel nutrition-wise at the very beginning, at the point of conception, is, of course, very helpful. We personally here use Saracen horse feeds, who have a very extensive range of stud mixes, cubes, and balancers, so they can suit mares of all shapes, sizes, dietary requirements. And to some extent, supplements could also be useful. Our friends at NAF have recently launched some supplements that could be helpful with mares' reproductive chances, so they are definitely worth looking into, talking to NAF. They have a very helpful helpline, and all these little things can just help have your mare in the best shape to start trying to breed. Then we would move on to costs to consider. So stud fees, unless you own the stallion or have a very generous friend, you will always have to pay a stud fee. These, of course, vary enormously depending on the breed, type, abilities of your chosen sire, so that's just a cost you always have to factor in. Vet costs, most vet practices doing a lot of repro work at this point would offer reproductive packages, certainly B&W do, which is a very good way of sort of trying to offer an all-encompassing, we will offer you these scans, this amount of management for this period of time, usually for one cycle, whilst trying to breed your mare. Whilst these are very helpful budgeting tools, it is important to look at what they include. You know, they require a certain level of scrutiny, as undoubtedly the ones that look very cheap ultimately don't tend to include very much at all, and you find yourself out of pocket further down the line. So looking for good packages which are clear in what they offer and will cover 90% of all eventualities with your mare is a great budgeting tool. Additionally, on the vet costs, there obviously will be costs to things like the CEM swabs and the EVA bloods. They are not enormous, but it is just another slight veterinary expense. And then, of course, when you send your mare away to stud, there will be keep fees, which will range depending on where you go. Grass livery, obviously much cheaper than stables. So Hopefully that has given a bit of an insight into the initial preparation of your mare before you send her to stud. And we will now hand over to Chris Shepherd, who will talk to you about basic mare anatomy and pharmacology relevant to AI. So, quick advert for PW vets there.
Great. Thanks, Harry. Yeah, the title of my presentation is Mare Anatomy Relevant to AI. My aims for the next 10-15 minutes is to help you understand why, as mares get older, they become more difficult to get pregnant, and also with anatomy considerations, make it easier for owners to understand and appreciate the various techniques that we as stud vets use on your mares. Sorry, just back one, Harry. Thank you. So the main bits of the reproductive tract that I'm going to talk about are number one, vulval conformation, number two, the cervix, obviously the uterus, oviducts, and ovaries. And here we've got quite a nice diagrammatic presentation of the female reproductive tract. Next slide, please. So, yeah, starting with vulval conformation, there's a couple of illustrations here of good conformation versus bad conformation. On the left of the very left of the slide, we can see that ideally the angle of the vulva is completely vertical, as opposed to poorer conformation where it becomes angled and becomes less satisfactory. Next slide, please. Sorry, back one. So the reason that vulval conformation is so important is that it is the first barrier for preventing infection getting into the female reproductive tract. And basically, mares are quite a bad design, in so much that fecal contamination can very easily find its way through the vulva and up into the reproductive tract if the conformation is poor. Breed of the mare, the age of the mare. As I say, we're going to mention age a few times in the presentation, but undoubtedly, as mares get older, the vulval conformation does tend to deteriorate. The anus sinks forward and pulls the vulva forward, so they develop this angled appearance to the vulva. And therefore, uterine infections are quite common in mares as a result of poor vulval conformation. We're not talking about any sort of infection that is of any significance other than when we're trying to get mares pregnant. So if you're not trying to get a mare pregnant, then it's no big deal. But if we are trying to get them pregnant, then any minor infection that's got up into the uterus most definitely is significant. So therefore, we pretty much routinely take swabs from inside the uterus before we inseminate them. And there is the option, we have a Caslick procedure for mares that do have poor vulval conformation, whereby we can stitch or suture or seal possibly the top half of the vulva to try and prevent any sort of fecal contamination gaining entry to the reproductive tract. Next slide, please. Yeah, slightly sidetracking here away from anatomy, but while we're talking about uterine infections, the other possible cause of such infections are post-foaling. Most likely, if it's been a difficult foaling or an assisted foaling, or if a placenta has been retained for more than the normal 3 hours, which we normally classify as satisfactory. And therefore, again, we would always want to swab foaling mares before they're re-inseminated to make sure that they haven't got any minor infections left as a result of the foaling. Next slide. Yeah, and sidetracking again, I just want to mention foal heat, because it's quite often a question that comes up from breeders as to whether they should or can inseminate their mares on foal heat. So the foal heat can be over and finished anywhere between 6 and 12 days after foaling. So it can be very, very soon after they fold. And it is basically a cleansing, what we call a cleansing heat, where the uterus is involuting and any fluid left over from foaling is being eliminated. So by choice, we don't breed mares on foal heat, but on occasion, if time pressure is an issue, we can do, but it is very dependent on swabs and smears being taken from inside the uterus to make sure that they are clean, and ultrasound scans on the mare to make sure that the uterus is involuted as it should do. We sort of have a minimum period that you would breed a mare post-foaling. So if they have ovulated before 10 days post-foaling, then well, certainly in my mind, that's a no-no to inseminating them. But if they are still in season beyond 10 days to that 12-day period, then if time pressure is an issue, if it's getting very late in the season, if your mares fold late in the season, then as long as swabs and smears and scans are okay, then it may be an option. Next slide, please. So moving further up the reproductive tract, the next really important bit of anatomy is the cervix, which you can see on the diagram here. But just to describe it, so yeah, it's a 5 to 7 centimeter tubular structure. It's made of connective tissue and has got a muscular component to it as well. Very relevant to AI because we have to pass the insemination catheter through the cervix to deposit semen into the uterus. It's another barrier. It's the third barrier, what we call the third barrier to infection reaching the uterus. And at the most part of the cycle, reproductive cycle, and certainly when mares are pregnant, it's pretty tight shut to serve its purpose of stopping infection getting into the uterus. But when the mare's in season, the central canal of the cervix is quite open, and the cervix is quite relaxed. We use a scale in our practice of 0 to 3 to assess the relaxation of the cervix, and basically, as a rough guide, that means how many fingers you could put into the cervix when, if you wanted to, when you're passing insemination catheter, and when they're fully in season with a normal mare, you could, I'm not saying you would, but you could get 2 or 3 fingers into the cervix. And important to understand and be aware that we can only take swabs from inside the uterus when the cervix is relaxed, when the mare is in season. Next slide, please. So, talking about aging changes, and Harry has already mentioned this, but as mares get older, there is a age-related fibrosis of the cervix, particularly in maiden mares which have never had a foal before. So the cervix has never been stretched in delivery of the foal. And ultimately it means that when they're in season and they should have a nice relaxed cervix, that is not happening. And therefore, when they're inseminated, and whenever a mare's inseminated, there is a bit of reaction in the uterus and a bit of fluid formation, and that can normally get out through that nicely relaxed cervix. But if it's an older maiden mare, then it can't get out, and on ultrasound we see this sort of fluid accumulation in the uterus that we can see here. So for us as stud vets, after we've inseminated mares, particularly if they're older maiden mares or they've got we know they've got a tight cervix, then recognizing this fluid and treating it is really important. And whatever we do, we have to acknowledge that the breeding prognosis is going to be reduced if we're battling with fluid. Next slide, please. So yeah, moving further down, the uterus, anatomically, it's about 20, the horns of the uterus about 20 centimeters long, body about 15 centimeters. It's obviously in the uterus that we deposit semen when we're inseminating the mare. You can see on the slide here the difference between the uterine body and the uterine horn. If we're inseminating fresh or chilled semen, we just put the catheter through the cervix into the body of the uterus and deposit the semen there. We're inseminating frozen semen. We usually pass the catheter right to the tip of the uterine horn, just next to the oviduct, and deposit the semen there. Microscopically, the uterine lining consists of lots of uterine glands which produce histotroph, or what's commonly called uterine milk, which is important for development of the early embryo. And then secondly, the young healthy uterus has a really good blood supply, which ensures, as and when the mare's pregnant and the placenta has developed, that with a good blood supply that ensures placental transfer of nutrients. Next slide, please. But as mares get older, there are age-related changes to the number of uterine glands, and the blood supply is also a bit diminished, and because of age-related fibrosis of the uterus. And so for both those reasons, the uterus becomes less able to support a developing embryo and ultimately fetus. We've got the option of, if we want to determine the extent of age-related degeneration, we can take a uterine biopsy and then send it off to the lab, and they'll grade the likelihood of that mare getting pregnant and carrying a pregnancy to term. There's not much we can do, if anything, about age-related uterine degeneration, but we need to be aware of it, and so we can give a realistic breeding prognosis. Next slide, please. So the oviduct between the tip of the uterine horn and the ovary, fallopian tube in human terms, but we call it the oviduct. So the oocyte, or egg, released from the ovary, enters the oviduct and stays in the oviduct. It's where it's fertilized, and then the very early embryo stays in the uterus for 4 or 5 days, and only at that stage does it then enter into the uterus. So that means that if we do have any uterine fluid or minor infections that need treating, we can do that for 3 or 4 days after insemination, because the little tiny embryo is up in the oviduct, and there's quite an effective valve between oviduct and uterus. So we can flush the uterus and treat any fluid without risking flushing the embryo out. Next slide, please. Ovaries. Yeah, approximately orange size. They'll usually contain a number of fluid-filled follicles, which we can see on the scan here. One of which is going to mature and ovulate each cycle. Yeah, going back to age, one thing that doesn't happen with older mares is that they don't stop cycling. Mares will continue cycling into very late life. So it's not that stops us getting them pregnant. It's more the other issues with cervical and uterine problems that we've just talked about. Next slide, please. Just a quick description of ovulation. So the egg or oocyte is obviously tiny. It's contained in that follicular fluid. And ovulation is a fairly rapid process over a few seconds, where the egg is effectively flushed into the oviduct by a flow of follicular fluid. The follicle is then collapses and is replaced by a corpus luteum, which then produces progesterone, which is the hormone of pregnancy. But the prediction of ovulation is really important tool that we stud vets spend an awful lot of time doing, and there's various parameters that we use on follicle size, appearance of the uterus, but knowing, predicting when the mare is going to ovulate will determine when she needs inseminating. And then finally, just a couple of slides on a bit of pharmacology. Sorry, just go back one, please, Harry. So the induction, what we call the induction of ovulation, the use of drugs allow us to have some control in the timing of ovulation. And as I've just said, the timing of ovulation is crucial in relation to when we're going to inseminate the mare. So for us to have some control of ovulation is really useful. And pretty much routinely, we either use Coralin or Deslorelin to be able to do that. Important to be aware that both of those have a delayed effect. Doesn't make them ovulate immediately you inject it. In fact, it's about a 40-hour delay. So we use it in advance of when we're going to inseminate the mare. And then second bit of pharmacology, which we use very commonly and just want everybody to be aware of, is the use of prostaglandin, or we call it PG. The natural prostaglandin is prostaglandin F2 alpha. We normally use a synthetic analog. There's various ones, estramate being one of the common ones that we use. And by using it, we can advance a cycle. So rather than waiting 21 days for a mare to come back into season, we can short cycle the mare and get her back in season a bit quicker, or we can use it for trying to get mares in season and ovulating when we want them to, i.e. maybe trying to avoid them being in season over a weekend when deliveries of chilled semen might be more difficult. Common question that often comes up is the fertility of an induced cycle the same as a natural cycle? And in nearly all cases, we would say, yes, it is. Don't be afraid of using it. Just one scenario that can be difficult, and we always like to scan mares before we inject prostaglandin. If they've already got quite a big follicle, when we administer it, they can come in season, ovulate really quickly, and that's not ideal. But in other respects, we use it a lot, and it's really useful. So yeah, that's it for me. Harry, back to you. Thank you very much.
Thank you very much for that, Chris. I will now hand you over to Kelly Harrison-Tate, who will be discussing semen selection and how to get it right for your mare. So we are.
Okay, hello, good evening, everybody. It's a difficult question to answer, I believe this, but I'm going to try my best to give you some guidance on what semen to choose for your mare. So I'm just going to go through initially of 3 types of semen that are available for artificial insemination of the mare in the UK. The first being fresh semen. So this is still collected, so it's not the same as natural cover. When we say fresh semen, we do mean when it's collected by from the stallion on a dummy with an artificial vagina, which is in this picture here, and it's collected at the stallion centre in close proximity to the mare, and it needs to be inseminated within a few hours in its raw or sometimes diluted or extended state, depending on the stallion. We sometimes do add some extender into it, and ideally we would inseminate it within an hour of being collected if it's collected raw. If it has to travel any distance, even quite locally, or there's any any risk of a delay, then we will put some extender with it to maximize its longevity. But if the stallion's on site and the mare's there or very nearby, then we can do the fresh semen raw. And we keep it at ambient temperature, so that's room temperature, or placed in an insulated box. It's still important on a warm day or a very, very cold day, so we're experiencing at the moment some days, that it is not exposed to extremes of temperature, as that can damage the sperm cells. So we do still tend to put it in a polystyrene box without ice packs in. And from fresh semen, if you're receiving it and the stallion is off-site or not collected by yourself, then when you receive it, you should check it, or get the vet should check it, and we'd expect at least 60% motility of that semen. Next slide, please, Harry. So the advantages of using fresh semen, our extenders are usually not required, as discussed. We try and use it raw, it's one of the bonuses. And extenders can cause inflammatory reactions within the mare, so not using extenders can reduce these reactions from occurring. The short duration between collection and insemination ensures the semen is at its best, it's at its most fresh state, and motility should be at its highest. It should last over 48 hours once within the mare. Would usually expect it to last at least 3 days, but 48 hours minimum. So there's less intensive mare management needed for scanning. After insemination, just scan her the next day, ideally, or even the day after. And if she's ovulated, then the fertilization should have occurred. You also often get an entire ejaculate, which is over 4 billion sperm, which, as when we compare the other methods, is you'll see considerably more. As the other methods are often split for shipping into more doses for different mares. Negatives are mare must be in the close vicinity to the stallion. So fresh only works if you're within an hour of where the stallion is kept, or your mare is, or you'll have to send your mare to that centre. And also personnel must be available to inseminate the mare as soon as the semen is collected. So you can't leave it sat on the side of the stocks room and await for a personnel to come and inseminate it if you can't do it yourself. And that can cause some logistics and a courier. The next type of semen is chilled semen. So this again is collected from the stallion and then it's diluted with semen extender, and that improves and maintains the motility of the semen, improves the longevity so that it will last longer than fresh semen does. The extender contains nutrients and often antibiotics. The nutrients to give the sperm cells energy, and antibiotics to prevent any infection or bacterial growth within that semen sample. On receipt of the semen, it should be at least 50%, and ideally below 50%, you'd be a bit disappointed to receive. And insemination occurs within 36 hours after collection, generally. Centrifugation can also be performed. That is where the semen is spun at high speeds, and what that means is the sperm cells end up as a pellet at the bottom of the centrifuge tube. The fluid is removed, and then it's resuspended within semen extender. This can remove something called seminal plasma that is released by the accessory sex glands of the stallion. Often seminal plasma can assist the quality of the semen, but on occasion it can be detrimental, and removing this will massively improve it. So collecting semen by AI and centrifuging it can increase your stallion's fertility or the stallion's fertility. Okay, next slide. So advantages of chilled semen: it can be shipped from further afield. So often we received chilled semen from Europe, and this allows access to more stallions on the continent. It also allows processing of the semen that can improve quality, as I've just said, centrifugation, removing of seminal plasma, or sometimes adding seminal plasma from a more fertile stallion can also improve it, and using extenders as well to improve the longevity of the semen. Negatives are logistics of ordering. You often need to order up to 48 hours before the mare ovulates, and that can be difficult to predict. Cost and reliability of shipping and customs of coming from Europe. Post-Brexit, we had quite a dip in successful deliveries from Europe of semen. It seems to have improved, and we're trying to make some ground on that and have a better relationship through customs of this product. And last year it was markedly improved and with little problems. And let's hope for a similar year this year. Negatives again, is semen quality reduces over time. So the shipping, the time that is spent in the air or getting to you, is time where the sperm cells are potentially becoming less motile, and the percentage of motility is reducing. If the mare does not ovulate when expected and when predicted, it can be difficult to repeat the order. It also incurs another cost, shipping, customs, and due to the large amount of time often needed to put an order in request before the mare ovulates, by the time you have ordered and received the second shipment, it might actually all be too late. There can be restrictions on days the stallion collects. Often the stallions used for chilled semen shipping are competition stallions, and they mainly collect on Monday, Wednesday, Fridays, or Tuesday, Thursday, Fridays, or similar days. And therefore, it's another factor into programming your mare. And you cannot receive semen from Europe in particular on Sundays, Mondays, or bank holidays. So courier system doesn't work. And that includes European bank holidays. So we have to put them in the calendar too. Chilled semen within the UK, we can often find a courier to get it to you even on these days, but often at a higher expense. So this is just a video of myself actually inseminating a mare at our Willersley clinic of B&W with chilled semen. So you can see it's come in a polystyrene box. I've just got sterile rectal gloves. The mare's been washed off already. Her tail's been tied up out the way. It's a sterile AI pipette taken out of a sheath, and I'm just placing it through the cervix and feeding it through. Secure it in, and once it's in, it will comfortably sit there. Just getting the semen out of the box. In this case, it's two syringes of semen, and inserting it through the AI catheter. At the end, you push through a small amount of air, or in this case, I haven't, because I'm just collecting a small sample of a couple of mils, and I'll just check that under the microscope to be sure that I'm happy with the quality of it. So that just opens up for anybody who hasn't seen insemination before of how it occurs. So you can see the mare was very relaxed with us for that. Frozen semen, its first documented pregnancy from frozen semen was in 1957, so it's not a new concept, sorry. And we certainly inseminate semen that's been frozen a good 30 years ago on quite a regular basis each year. So it is an established way of preserving semen. It's processed at the time of collecting and frozen in liquid nitrogen within half mil straws. And if using frozen semen, the important thing is to ensure it is where the mare is. Once it's frozen, it can be moved anywhere, but it just has to be kept within a tank that is topped up with liquid nitrogen. As the nitrogen can evaporate, and then the semen within it can thaw, which is detrimental to its quality. It may require 2 doses of semen and 2 inseminations, depending on the mare's setup. But ideally, it should be ensured that a minimum of 1 full dose of 300 million motile sperm is purchased. 1 straw is not a dose. The maximum amount of motile sperm per straw is around 75 million. We often do receive just 1 straw to inseminate a mare with for pregnancy, and we can make it work. It just reduces everything like that, where sperm numbers are reduced, for example, will just reduce the success rates of the cycle, but we certainly can make it happen. You check semen motility under the microscope at the point of insemination. And for that, you do need a slide that's heated to about 35 to 37 degrees centigrade. So it mimics a mare's temperature to see a true motility. Okay, next. So pros of frozen semen, so it can be stored indefinitely. So you can buy it whenever you like and keep it indefinitely in most cases. Just check with the stallion owner. Can be kept with the mare when ovulating is impending. That ensures there's no shipping issues. You can inseminate it then at any time of day or night, on any day of the week, and it will be the same result. It can be shipped worldwide, so this enables genetics to be brought over from countries as far as Australia, New Zealand, Canada, India, Japan, and vice versa. So it allows genetics and horse breeds to be bred across the world. And the ejaculates can be split between many doses, which has the pros of, again, of meaning that the stallion can inseminate more mares per ejaculate. And the preservation of genetics is also important. So especially for some of the rare breeds, you know, sadly, we have semen stored from stallions that have passed away, but it's very nice to be able to continue his line of progeny by using his cryopreserved genetics. Negatives is you can't assess quality until the point of insemination. You can only assess it on thawing of the semen, and we're not able to thaw and refreeze, as that would have an extreme detrimental effect on the quality of the semen. Once the semen is thawed, it's got a much shorter longevity than that of chilled or fresh, so the timing of insemination has to be pretty perfect, which does make it more intense for scanning the mare. And some stallions' semen does not preserve well when frozen, or motility is very poor. So there's some stallions that do excellently when fresh or chilled, but when frozen and examining the semen on thawing, the semen looks very poor and is likely to have a poor success rate pregnancy. Okay. So fresh semen, when to order. Ensure the stallion or semen is available, and know the chosen stallion's likely availability before starting the process. As a stud vet, it's really nice when you turn up with a mare if you have some information on that stallion, or we might give the stallion agent or owner a call and just make sure he is available and what days of the week they can collect and what days we can receive the semen. That gives us the maximum chance of setting up the mare appropriately. Mare can be manipulated to a degree if necessary. We can do our best to prolong her cycle or make her ovulate a bit earlier than she would naturally. And that can help with matching up the timings of the stallion with the mare. If all is okay with the stallion and we know that we can receive the semen, we can give an ovulation agent. Chris touched on this already. Generally, we would use Coralon or Deslorelin, which are either an LH or a GnRH agonist, and usually 24 hours before the planned insemination is when this is given. The mares will ovulate between 36 and 48 hours after receiving the ovulation agent. So that means that they will ovulate between 12 and 24 hours after insemination of the semen. So should be within plenty of time for the semen to still be motile and reach that oocyte. You check the semen motility under the microscope, and if possible, keeping it in the fridge for 24 hours and checking a little bit the next day can also be a useful guide. Excuse me, particularly if the mare has not ovulated when you examine her the next day. Okay. Frozen semen, when to order? Well, now it's the best thing about using frozen semen, in my opinion. As you know, the semen's there. If the mare suddenly comes on quickly, or pauses, or comes on over a weekend and you can't slow her down or whatever, having the semen nearby, either at the vet clinic near you, or it can be stored on site with where the mare is safely, is is the best thing about it. If no local premises can have a semen storage facility, you can store it at the yard for several days. We'd really advise maximum of a week. If the nitrogen's not topped up regularly, then as I've already mentioned, it will evaporate and the semen will thaw. And then when we come to use it, it won't be any good to the mare. So it's really important that if you do have it delivered to your yard, it's not there for too long before it's assessed by a local semen centre. Quite a wordy slide, sorry about that, but ovulation, timings explained for frozen semen. So ovulation, you want 2 days, 2 days frozen semen insemination protocol is to inseminate either side of the ovulation. So because the longevity of the semen is only approximately 6 hours post-thaw on average, we want to make sure that the mare ovulates within that time frame so that the semen is alive, sperm are alive as the mare is ovulating. So we give the ovulation agent for a 2 days protocol at 7 a.m. The mare is scanned and inseminated at 7 p.m. the following day, so 36 hours after that, and that's repeated at 12 hours later. And if the mare's ovulated, then she will receive the second dose of frozen semen. As I said before, the ovulation agent usually makes them ovulate between 36 and 48 hours, usually between 38 and 42, but broadly speaking, 36 and 48. So if we scan and inseminate them at the 36 and 48 hour marker, we should definitely have been within 6 hours of that ovulation. You can also, if you have one dose of frozen semen with multiple straws, split that dose. So there's 8 straws, do 4 straws in the evening and then 4 straws the following morning. The other option, which is probably more commonly what we experience, is 1 dose of frozen semen protocol. And for that, you inseminate after the ovulation. So the oocyte remains viable for 8 to 12 hours post-ovulation. So inseminating within that time frame should mean that the sperm and the oocyte meet and fertilization occurs. So for 1 dose you ovulate, the ovulation agent is given at 7 p.m. in the evening, roughly, approximately. You scan the following day to ensure the mare is on track. And then the important thing is that you go pretty early the day after that. So she is scanned at about 36 hours. And then you make a call on what time of day you go back to look at her. So for example, this morning, I was on the yard at about 7:30 a.m. and I thought she looked very close. And I went back just before 11 a.m. and she'd ovulated. So I then was very confident that that mare had ovulated in the 3 hours before I inseminated her. So the oocyte should be viable and hopefully it will be a success. I'll let you know. For frozen semen as well, you do deep uterine horn insemination, and that's to ensure that we place the semen at the tip of the uterine horn, which holds the entrance to the oviduct. Because that you then have to pull this back per rectum, only a qualified vet is able to do this, but it is quite a useful thing to do. Mainly because the volume of the frozen semen is so small. 1/2 ml straws, you've got 4 straws, that's only 2 ml of semen. Okay. And what suits my mare? Well, ultimately, good semen is best. We receive some excellent frozen semen, and we can receive some poor frozen semen, and same for fresh and chilled as well. Properly processed and with good motility and viability is vital for success. Having a complete dose is really important. So ideally, you should have 500 million motile sperm. For fresh and chilled stallions, and 300 million motile sperm is the commercial minimum dose for frozen. Older maiden mares generally benefit from fresh semen. However, as it is likely to be of better quality, as we said, usually fresh is then put straight in the mare. It's got its maximum motility. And also there's a low incidence of inflammatory reactions if using raw, as no extenders have been introduced. On tight cervixes, because they're maidens and they haven't been stretched, can make inflammatory reactions more troublesome. Frozen semen requires more intensive scanning, due to the proximity to ovulation where insemination needs to occur. So it's important that your mare is of the temperament that she won't object to being scanned relatively regularly around her point of ovulation. Okay. Conception rate. So there's actually similar success rates observed with all three types of semen. And the range is between 43 to 63% pregnancy rates per cycle. And fresh is mildly superior to frozen and chilled. As fresh is 60 to 63%, frozen 46 to 59%, and chilled just under 43 to 59% success. So that's per insemination. The large variety in semen quality received within all three methods of processing make it difficult to have a clear answer on which type is to select for the best result. And children frozen are very comparable with the fresh. The mare factor is a strong influence in these rates, and I'm sure all of these figures include a wide variety of mares, and that will contribute to the figure seen. Okay. So this has already been quite heavily touched on tonight, but the mare's uterus does begin to change from the age of 6. And older mares conceptus are also more susceptible to genetic defects due to aging oocytes, and would experience a slightly higher percentage of early embryonic loss. Having said that, a main demographic is teenage maidens that retire from competition career, and it can work, and it works every year for most of the mares. But it's just important to have realistic expectations on success and to not be too disheartened if it doesn't work first time. A single dose frozen semen would be preferable for the older mare over the 2 or split dose insemination protocol for frozen, as there's no need to inseminate twice. So if you've got an inflammatory reaction from that first insemination, you're then not looking to exacerbate it with a second dose. And the whole health of your mare should be considered, as concurrent health conditions can also have an effect on your pregnancy success results. Okay. So in summary, there are 3 main forms of semen for artificial insemination: fresh, chilled, and frozen. A full dose of good quality semen results in similar conception rates regardless of its form. And I'd advise that you discuss it with your vet to assess what would be the best to select for your mare. And also to ensure that your aspirations of what foal you would like are also considered. and try to listen to them and say, do you want a foal as much as you want one? Thank you very much. Back to Harry.
Okay, thank you very much for that, Kelly, and I'm pleased your voice held out till the end. So we will now hand you over to Anna Mitchell on the subject of advanced assisted reproduction techniques.
Great, thanks Harry, and thanks everyone for being here. I'm just going to go through sort of this very superficially, just some other breeding options. We've talked about AI. So if we move on, Harry, obviously the most basic other breeding option is natural cover, but we're going to focus on the more advanced assisted reproductive techniques, particularly focusing on embryo transfer and ovum pick-up for ICSI, so intracytoplasmic sperm injection. And there are many more reproductive technologies that are in use these, but we're going to focus on those which are sort of the most common. So if you move on, Harry. So obviously, as I mentioned, the most basic form of breeding being the most natural, being natural cover. So whether it's this herd situation at the top here, or whether it's hand breeding, or it's sort of in a breeding shed as with thoroughbreds is common. And then here at the bottom we have collecting off a dummy mare for assisted reproduction. And the advantages of assisted reproductive techniques, starting with the most simple being AI, but including embryo transfer and ICSI. So these technologies can help overcome limitations with reproduction or fertility, and also increase productivity. And we'll go into that more. It can also reduce the risk of infectious disease spread or injury risk. Certainly, collecting off a dummy or a phantom mare here at the bottom. We don't have any hind legs of a mare that might be objecting to things. So it can be safer for personnel, but also for the animals themselves, and for the stallion himself certainly can be safer. And it means that we can preserve and spread genetic material of these elite animals and propagate their genetics throughout the world without both being next to each other. But obviously there are limitations with certain breeds, particularly thoroughbreds, that can only be bred naturally. So if we move on, Harry. So if we think about artificial insemination, that we've talked about lots, we need a fertile egg and sperm to develop, or oocyte and sperm to develop. We need them to fertilize in the mare, the embryo to then develop it first in the oviducts or the fallopian tubes, and then enter the uterus and maintain pregnancy for the duration of the 11 months, and for the foal to be successfully born. So all that needs to work with AI and natural cover. So if we move on, Harry. But then moving to other options, we sort of bypass some of that process. So starting with embryo transfer. So the donor mare is bred by fresh, chilled or frozen semen, and the mare hopefully conceives, the embryo enters the uterus and then is flushed out at about day 7 or 8 after ovulation, flushed out of the uterus and then transferred into a recipient mare who will then carry the pregnancy. So the advantages being that a donor mare can produce more than one offspring per year, and she doesn't need to carry it, so she can, if she's in competition work, she can carry on training. Certain mares that may struggle to carry a foal to term, so they're able to conceive, but then may have some of those degenerative changes that Chris talked about, which mean that they're more at risk of aborting that mare or aborting that foal early and delivering preterm when that foal isn't viable. So the embryo being transferred into a fertile recipient can overcome that sort of problem. And other advantage, the embryo can be flushed and then frozen if desired. That's less commonly done, but certainly can be an option. And most breed registries will accept embryo transfer foals. So in this case that we're talking about the embryo transfer, so that maintenance of pregnancy in the uterus isn't needed. So we move on, Harry. So as I say, she's bred as usual, and then we it's day 7 or 8 post-ovulation. This catheter is passed into the uterus in this slightly schematic diagram, and then flushed out, filtered, and transferred through the cervix into the recipient mare, whose cycle has been synchronized to the donor mare. And this at the bottom is a filter that we use to catch the embryo in, basically, and then identify it under a microscope. So moving on, and the success depends on similar factors to artificial insemination. So semen quality, the fertility of the donor mare, the ability that she has to produce an embryo. So if she has a problem with her either her ovaries or her oviduct, she's going to struggle to produce that embryo or for it to reach the uterus. Also massively dependent on the recipient mare fertility. But a donor typically produces an embryo at a similar rate, or as a similar have sort of similar expectations to normal pregnancy rates if she was going to carry it. So it's a very reliable technique. If there is an embryo there, the recovery rates is equivalent, and an embryo transferred to a suitable recipient has high pregnancy rates. So that pregnancy will make it in sort of at least 70 to 80% of the time. That's what was reported. We actually run at higher rates of that within our practice. And then moving on to we'll touch on a recipient mare because it's such a crucial part of a successful embryo transfer program is the recipient mare. So having a young brood mare, ideally proven fertility, but certainly young maidens can be suitable, and ideally with mothering, sort of proven good mothering. But again, younger maidens can be very successful and need to be reproductively and physically sound, and for size matched to the donor, as they will have a significant impact on the birth size of that foal. And we really want to have a minimum of 2 recipients lined up to the donor mare, synchronized with the donor mare, just in case someone does something unexpected, or say that recipient mare one of the recipients has a little bit of fluid, or just before ovulation, or doesn't ovulate when expected, or one goes a bit slower or quicker than the other. It's really important to have multiples lined up, and really can reduce a lot of frustration and disappointment. And then we can also transfer or ship a flushed embryo to a herd. So our group of recipient mares that we have within our practice, or that West Kington also has a group of recipient mares, we can receive embryos that have been shipped from other practices to transfer into our mares, which can be handy as well. And then just touching we'll do a very brief. I realise that it's getting later, so we'll do a brief discussion about ovum pickup and intracytoplasmic sperm injection. So this is where an oocyte or an egg is harvested, and then there's in vitro, so in a dish, the egg is injected with the sperm, and hopefully an embryo is then produced. So the first foal born by IVF was in 1996, and then since then, ovum pickup and ICSI has become increasingly popular, and it's pretty commonplace nowadays. So if you move on, Harry. So with ovum pickup and ICSI, we need a decent one sperm, and we need good quality eggs or oocytes, but we don't need fertilization to take place in the mare. We don't need the embryo to develop in the mare. So we basically bypass all those parts. So mares that are unable to produce embryos due to some certain issues, so potentially ovarian issues, although they need to have still good quality oocytes, but certainly oviduct, certain ovarian issues and uterine problems can really benefit from this technology. So that can include some aged mares, but or mares that aren't able to produce an embryo, even to the stage where it can be flushed for conventional embryo transfer. Really popular use of it is in mares with a heavy competition schedule, because it can be done at any stage of the cycle, and actually it's best when the mare's not cycling fully, so it's sort of in the spring and autumn, when she's either in the transitional phase gearing up to start cycling in the summer, so in the spring transitional period, or in the autumn when she's winding down. Those can be the best times when she has quite a lot of small follicles. Subfertile stallions can also benefit from this technology, so in that we need very small numbers of sperm, and they don't, and there's not necessarily good correlation. So a stallion that doesn't have good pregnancy rates with sort of in vivo or in sort of it with AI can actually be really successful when used for ICSI. And similarly, stallions with a very small reserve of semen can be really useful. Let's move on. So it's performed, the ovum pickup, so the egg harvesting part is performed in a standing sedated mare. We give intestinal relaxants and pain relief, and sometimes an epidural, and no hormonal treatments needed. As the one thing that we do need her to have is a lot of these small follicles. So at least 15 small follicles, sort of 10 to 20 or 25 millimeters is ideal. And then we have this big, long ultrasound probe that goes into the vagina, and there's a needle probe, sort of a needle guide that goes through, and then a large needle. Let's move on, Harry. A large needle goes through this guide, and then punctures the follicle within the ovary. I think there should be a video here if it will play ball. So you can just see the needle in that black fluid within the follicle. The needle's, it's a bit wobbly this video, but the needle's scraping the edges of the follicle to release the oocyte, and there's fluid being flushed in, which you'll see that it's just expanding. The fluid's been instilled in and then is sucked out again, and again then we can search the fluid. If we move on, Harry. We can search the fluid again within a filter, and process these oocytes and transport them in a special temperature-controlled box to the ICSI lab, where they're then matured and are ready for fertilization, which which if we move on, Harry, you should be able to see. So this is fertilization is performed using this sort of robotic arms called a micromanipulator, where the oocytes held in this left-hand needle, and then the sperm's in this right-hand needle, and it's injected into the egg. Okay. And then over 7 to 9 days, hopefully, embryos will develop from those oocytes, and can be frozen and then transported back and transferred into a recipient when convenient. Okay. So the success rate. So the biggest factor affecting success rate is the number of follicles that mare starts with, because at each stage, as you can see, we lose some. So we expect to recover about 60% of the follicles that are scraped. We expect to get an egg from, and then 60% of those will then go on to mature, and then from the ones fertilized, only some will go on to produce an embryo. So it's really important to start with a good number to begin with. But on average, we can expect to get between 1 and 2 embryos per session, so per harvesting session. Sometimes it can be way more, and there are, multiples. It can even, there are the odd reporter that going into the teens of an embryos produced from one session, but equally it can be disappointing, and you can be the unlucky one that doesn't get an embryo from a session. But on average, there's a decent chance of getting between 1 and 2 per session, and a good at least 70% chance of, once that frozen thawed embryo has been transferred into a suitable recipient, we expect a pregnancy to establish in at least 70% of the time. But again, it can be certainly higher in our experience. Let's move on. And then this is something that we can do. So this is when we freeze embryos that have been flushed after. So the mare's bred, and then as for embryo transfer, and then the embryo is flushed, and that embryo can then be frozen to be transferred into a recipient. But I just sort of mentioned it's available. We won't go into it more than that. And we call it vitrification because it's a specific type of freezing that's very rapid and means that there's no ice crystal formation that can damage the embryo, but it's freezing basically. But certainly assisted reproductive techniques, so they've come on loads in the last sort of few decades, and can be really useful and effective tools in certain circumstances. But use sort of really careful consideration and really thorough understanding is really sort of essential for success, and sort of having the right expectations. And we're always happy to talk about options and give more information for any of these exciting techniques that might be of interest. Thank you. I think everyone's probably heard lots in a short space of time.
Yeah, thank you so much for that, Anna. That was great. So we will now move on to our Q&A session. So if anyone does have any questions to send in and hasn't sent them in yet, then please do send them now. That would be great. So we do have already. So yeah. My mare was inseminated several times with good motility fresh semen last year. My vet can't find any problems with the mare. Will changing the stallion make a difference? Would any of the vets like to take that one on?
I mean, I think it's always worth a try if you've had a thorough barren mare investigation, including a biopsy, thought about oviduct and fallopian tube blockages, and culture, and had a speculum exam of a vagina and cervix. And I think if you're still keen to, if all those are in check and you're still keen to breed, that changing stallion is definitely worth trying. As on occasion there can be a genetic mismatch which can cause poor success rates. I don't know what Anna and Chris think. It is usually a bit of a last, if the semen quality is good that you're receiving visually, then it can be a bit of a last attempt to change. But I've also worked with stallions that have poor fertility despite their semen looking excellent. So it is possible that there is a semen factor or a stallion factor involved. So I think if you are keen, that changing a stallion would be a sensible consideration.
Yeah, I agree with you. Oh, sorry, Chris, are you going?
Yeah, we just need to be aware that just assessing semen by looking at its motility doesn't mean everything. So the person asked whether the person said that the semen quality was good. I would assume that they'd made that comment purely based on motility, and there are some stallions that do have good motility semen as assessed under the microscope, but their pregnancy rates are still not very good, and there are other reasons why that might be, and therefore, if you can get information on pregnancy rates with the semen that you've been using, then that's really useful and informative. And then only at that point, if you've been assured that pregnancy rates with that semen that you've been using, it genuinely has got other mares pregnant, then yeah, maybe that is the point to try a different stallion.
Yeah, and I think also just being really mindful of really considering the mare really strongly as well, because I think there are lots of, diagnosing problems in mares isn't necessarily straightforward, and sometimes, a mare can even have a negative swab and not get in, and so then has a negative pregnancy scan, and we think, oh well, the swab was clean, it can't be her, but the bacteria in mares' uteruses are very clever and can hide out in biofilms and evade some of the sort of some sampling in some cases, and certainly sometimes we do these sort of treatments that then activate some bugs that are already there, and then we get a diagnosis, and actually, it was a mare problem. So it's always good when we're considering the stallion to have as much information on the mare and how she was managed and what her investigations were before pointing the finger at him.
Great. Well, I think, yeah, we've answered that very thoroughly. Interesting question for you. How important is the role of the vet in getting a mare pregnant? Who'd like to take that on?
Harry, I think you should answer that one. I think we might be biased.
Well, I mean, from my perspective as the only non-vet sat here on the panel, yes, I mean, obviously, as we know, in nature, horses can breed and things can happen. But what we are trying to achieve here is, yeah, breeding horses that would never have come across each other in the wild, maybe several hundred miles apart, may have age against them, may have various other factors against them. And therefore, I think having the knowledge and expertise of an excellent veterinary team as we have is invaluable, because there's always new research, there's always something that can be done, there's always help and intervention. So does that big you all up enough? Anyone have anything to add on that?
I think some mares get involved very easily and some don't. And yeah, I think that's when your vet becomes more important, probably.
Yeah, I think undoubtedly the role of the vet is very important through the points that we've talked about in these presentations. And yeah, I mean, I'd just make the point that we as vets feel the pressure when that mare is scanned for pregnancy, because we know that what we've done is very influential in whether the mare's going to get pregnant or not.
Another question just come in. Does prostaglandin act on the follicle or just on the corpus luteum?
Yeah, so it's acting on the corpus luteum. It's what we call lysing the corpus luteum. So it's obliterating the corpus luteum, and then once that's gone and the mare stops producing progesterone, then she will come back into season.
I don't know if I wonder if this question comes at all from, I know sometimes people are concerned whether prostaglandin can make some follicles more sort of abnormal and become sort of hemorrhagic, and I think the answer to that is that is sort of what Chris touched on, with is basically if you have a really big follicle that we're giving prostaglandin to, those cycles are fraught with difficulties, and some of those are destined to become problematic follicles anyway. So, but certainly when we're giving prostaglandin to in a normal cycle with nice small follicles, then I don't think our follicles are in trouble.
But that's the reason why we always like to scan them before we give prostaglandin, so we know what follicle size the mare's got, and we know how well or badly, as the case may be, she's going to respond to it. But overall, we use it a lot, and in most cases, with the proviso that we've already scanned the mare, it does work well. We use it a lot. It's really useful, and in most cases, in my opinion, the season that it induces is perfectly fertile.
Okay, and the last question we have at the moment, unless anyone's got any more hurriedly, is what makes a good recipient mare?
Well, so I mean, basically, you might be able to go back to the side, because really that sort of I mean, the sort of, it's almost like a sort of a checklist of sort of what she should look like on paper, and that really does sort of then transfer to success rates. So yeah, we want her. Age is a huge thing. Once they get into sort of into teens, basically fertility does decline, and so that mare's less likely to A, take an embryo and let it start developing, and B, carry to term. Good if we know that she is a good mother, but certainly we want her reproductive tract to be very sound. So if she's had foals before, we want her to have had a really a straightforward history in terms of getting in foal, no history of problems with foaling or any tears or any complications like that, or retained placentas even would be a bit wary about. And absolutely physically pasture sound. And yes, some of these really good recipient mares will have been retired from work due to some orthopedic issue, but we need them to be really comfortable as out at grass, and not going to be in sort of struggling with carrying the extra weight of a pregnancy, and that's definitely not fair on her or the foal. And as I mentioned, size definitely makes a mare suitable or unsuitable, because actually, interestingly, the size of the recipient, there are studies done where large, draft breed embryos were put into Shetland recipient mares, and the foals that came out were small, were sort of came out fine, were and were limited by that size of the recipient mare, weren't sort of oversized. And so that's obviously important if you want to have a nice big foal, and they will sort of even out a little bit with growth, but certainly the size is really important. And I suppose those are the sort of main things I'd say that are really, really important. Good teeth, also very important for that mare to be able to maintain good condition and therefore do the foal well.
And feet.
Yes, feet. Yeah, we don't want her to have to be
really those things could be said for any brood mare. And are probably things that people do overlook. So food for thought there. Okay, well, I don't have any other questions here, so we'll move back through the slides. So, yes, I think that sort of brings the evening to a close. So, thank you so much to all of our speakers, to Anna, Kelly, and Chris for sharing such valuable insights into breeding options for mares. I'd also like to thank everyone who's attended this evening's webinar, We hope it's provided you with a clearer understanding of the various methods and techniques on offer for your mares. If you'd like any further information on anything, ourselves at West Kington, along with the team at B&W, are always very happy to talk through our services, so please do get in touch. Yeah, we at West Kington Stud are already accepting mares for foaling, still awaiting the first foal, and we're accepting mares for insemination embryo transfer from the 1st of April, so you can contact us with the details there if you'd like any more information. And equally, B&W are very much up and running and available should anyone want to use their services. So please do get in touch. And once again, thank you very much for joining us for the webinar this evening. And we hope you enjoy the rest of your evening. Okay.
Thank you, Harry. Thanks for inviting me to speak today.
Thank you.
Great. Okay, goodbye. Stop.